Hi, this is Dr. Giuseppe Marinacci of Biohealth Holistic Dentistry. What's a biological extraction? So basically, when you have an extraction because your tooth is infected or dead, or for any other, Hi, this is Dr. Giuseppe Marinacci of Biohealth Holistic Dentistry. What's a biological extraction? So according to our biological approach, an extraction must be follow a special protocol if you want to avoid a partial bone healing, which could lead to a potential cavitation later on. And especially because obviously we need to boost the bone healing. Hi, this is Dr. Giuseppe Marinacci of Biohealth Holistic Dentistry. What's a biological extraction? So an extraction can be defined biological when it follows biology. So there are some biological rules that must be respected if we want to get a successful result. If you want to avoid a jawbone cavitation, if you want to place an implant and get it stable. So basically, a biological extraction starts with a blood test. So it's important to test some parameters to make sure that your body is going to heal properly. Okay, so you don't want high blood sugar, you don't want high levels of general inflammation, you want high levels of vitamin D, for example. Okay, so all these parameters must be in the right ranges in order you to basically heal properly, to regenerate the bone after. At the same time, you have to take some supplements. At the same time, you have to follow an anti-inflammatory diet, and a diet that can basically give you the right micronutrients in order to regenerate your bone and quickly. Okay, you don't want any stress. Okay, any kind of stress can basically trigger the function of the immune system. And also, that's your part. Okay, obviously you have to work as well on the detox protocol. Okay, if you have any intoxication with heavy metals, for example, like mercury, aluminum, or if you have any glyphosate in your gut. Hi, this is Dr. Giuseppe Marinacci of Biohealth Holistic Dentistry. What's a biological extraction? So a biological extraction is that extraction that follows biology, that follows some specific biological rules. Who does a biological extraction? The dentist, the patient, actually both. Okay, so the first part is done by the patient. So the patient must have a blood test to make sure that all the most important parameters are in the right ranges, because we want you to produce bone, we want you to deal with any potential infections. Okay, and for example, high levels of vitamin D, normal ranges of blood sugar, normal ranges of general inflammation. Okay, because you have to be prepared for what your body is going to demand. Okay, at the same time, you should have an anti-inflammatory diet. You should have a diet rich in nutrients, micronutrients, and micronutrients that will allow bone to regenerate and to heal in a proper way. What does the dentist then? So the biological extraction from the dentist side is an automatic extraction. Okay, so the dentist must be gentle when removing the tooth to preserve as much bone as possible. And all the infection from the bone needs to be removed. The periodontal ligament needs to be removed because all these tissues are already contaminated and infected. And obviously, the bone left must be decontaminated. Okay, we use ozone gas to decontaminate the bone, which is a very, very natural way and very effective. Okay, to kill any kind of germs, including viruses and fungi. And at the end, we use PRF, which stands for platelet-rich fibrin, which is a plasma product from your own blood, to fill the gap left or to fill any gaps around an immediate implant when an immediate implant is placed just after the extraction, when possible. Because this material, which is basically made from your own blood, is rich in platelets, it's rich in growth factors, stem cells, white cells in high concentration. And this material basically will boost the healing, make it more effective and faster. Obviously, you have to follow a special protocol, post-extraction special protocol, to make sure that all these components can be maintained during the months following the procedure, okay? Because obviously it's not just the day of the extraction, it's not just a few weeks before, but the bone takes months to heal, okay? And these conditions must be maintained during the full healing, okay? So biological extraction cannot be quick, okay? It must be scheduled in a proper way, and the timing is decided by your own biology, okay? The dentist doesn't decide, the patient doesn't decide, but biology basically is the boss here, okay? So we have to follow biology. Without biology, we don't get successful results. Without biology, we don't get what we are looking for.